Schizophrenia is a serious mental illness that affects 1% of the global population. Antipsychotic medications are the mainstay of treatment, but noncompliance rates as high as 50% mean that many schizophrenics go untreated, with very high cost to society in terms of rehospitalization. Long-acting injectables, or LAIs, are antipsychotic medications administered intramuscularly every 2 to 4 weeks that hold very great promise for stabilizing those with compliance issues. This would seem inherently true, as the patient who's potentially noncompliant must only commit to an injection every 2 to 4 weeks versus committing to a daily medication regimen, as is the case with traditional daily oral medications, or DOMs. The purpose of this project is to compare the impact that LAIs versus DOMs have on compliance rates in adult male and female schizophrenics ages 18 to 65 with at least one hospitalization in the last 12 months due to medication noncompliance. Specific objectives are to compare the impact that LAIs and DOMs have on medication compliance rates. 2, to analyze education strategies aimed at garnering support while inpatient for voluntary LAI compliance and treatment. 3, to compare the side effect profile of LAIs versus DOMs as measured by the AIMS tool. And 4, to compare the effect of LAIs versus DOMs on symptoms of schizophrenia as measured by the PANSS tool. The target audience is mental health providers, mental health nurses and managers, and anyone who has direct contact in a clinical environment, be it outpatient or inpatient, with this population. There's a growing body of literature that endorses LAIs as superior to DOMs. However, there is not an absolute consensus. Some randomized controlled trials, for example, have found no quantifiable difference between each type of regimen. However, RCTs do require informed consent, which is unlikely from potential participants with a history of noncompliance. These individuals are therefore naturally washed out of the sample, leading to sampling bias. Only one of the 3 RCTs reviewed by Gopal et al. Found LAIs to be superior, but all 3 reviewed made mention of the fact that RCTs are probably a poor vehicle to gauge compliance in this population due to the high potential for sampling bias. Other non-RCTs reviewed found that LAIs were superior to DOMs. Hong et al. Found that subjects on LAIs had compliance rates of over 60% versus only 44% of the DOMs. In addition, rehospitalization costs in LAIs were 50% cheaper than in DOMs. Viala et al. Report an improvement in quality of life of those treated with LAIs, marked by drastic changes in the clinical global functioning scores of participants. The proposed pilot consists of 3 phases, which I will now discuss. I will also discuss an overview of the evaluation measures. The initiation phase will occur at Aspen Behavioral Health Inpatient Psychiatric Unit. Each patient will undergo a Positive and Negative Syndrome Scale, or PANSS, test, as well as an Abnormal Involuntary Movement Scale, or AIMS test, by the primary investigator to establish a pre-study baseline. These tools are widely used across the United States and European mental health fields, and are considered highly valid and reliable. However, they do a poor job of garnering subject input regarding mental illness and treatment. Hence, he or she will also be asked to fill out a survey in which they self-report the intensity of their auditory and visual hallucinations on a scale of 1 to 10. In addition, they will be asked to complete a drug attitude inventory survey to gauge a perspective on the medication regimen. All participants will have 24 hours after that to give informed consent and join the study. If their AIMS scores show no pre-existing signs or symptoms of extrapyramidal syndrome, treatment will be initiated. For the DOM group, treatment is a daily bedtime dose of Risperdal 2 milligrams. For the LAI group, the first of 12 doses of Invega Sustenna, an active metabolite of Risperdal, will be administered intramuscularly. The goal sample size is 50 participants per group. The phase will last up to 2 weeks. The maintenance phase will run between weeks 2 and 52 at Aspen Behavioral Health Outpatient Department. It will consist of once monthly encounters to administer LAIs or dispense a 30-day supply of DOMs, perform all assessments previously mentioned that will address efficacy, side effects, and participant perspectives on the drug regimens. The termination and analysis phase lasts from weeks 53 to 56 and will begin with a 1-hour-long exit interview for each participant. Data analysis will then occur of all assessments and comparison of such between each group. Compliance will be measured by reviewing medical records to track subject attendance at scheduling monthly encounters during the previous phase. Subjects will be offered the chance to continue the regimen for 12 months on an outpatient basis if they agree to be followed by a pre-approved mental health provider.